MDNews Network recently attended the Medical Group Management Association's annual conference in New Orleans, where our cameras focused on attendees with opinions on everything from healthcare reform to healthcare technology. Here's what they had to say.
Well, I happen to work for a company that's very focused on information work and information worker. I mean, that's very much a part of our brand and what we do. And as a clinician coming to the company and thinking about the work that clinicians do day in and day out and how they are just surrounded by data. Unlike, banking or retail or financial services, this is data. When something goes awry, you don't lose money, you hurt somebody. And so it really struck me that as clinicians, historically, we've had very poor information worker tools. We've relied on pen and paper, certainly for much of my career. It has its advantages. It has strong disadvantages that we're becoming very much aware of today in terms of even with paper, there's privacy and security issues, obviously, the dumpster diving that goes on behind hospitals sometimes, so that's been an issue. You can't find data quickly, you can't organize data quickly when it's on paper. Things get lost. If you want to update policies and procedures and so forth, it's a manual, very laborious process. So as I reflected on the kinds of tools that we create and kind of what we know and the billions of dollars we spend on research around information workers, it really struck me that there were those certain things that I'm still not yet seeing across the board in the electronic systems that clinicians are using. There are some good ones out there, don't get me wrong, but we have a long ways to go, I think, in really hitting all of the criteria around information worker tools, mobility, data input options, interconnected, interoperable. We have a ways to go. I would start out by saying that I think it's only until fairly recently that the technology and its capabilities has caught up to really meet the demands of clinical workflow and the attributes that clinicians must have in the tools they use. Things like mobility and ubiquitous wireless, better data input options, although data input's still a barrier for them. We're behind in America for a number of reasons. Historically, the more public health systems, which is most of the rest of the world outside of the U.S., governments have made long ago deep investments in information technology, which is why across most of Western Europe and Asia, and actually even in some rather undeveloped countries, you see 90 to 100% EMR use. In fact, I'm a little troubled when I travel overseas because I comment on our implementation and adoption rates here in America, and people in Europe can't believe that doctors in America are still using pencil and paper. They just absolutely can't believe it. So part of it has been here a lack of government investment, which is now beginning to turn around with the era stimulus money and high tech and all of that, which I know is controversial. And the question is, because the tools we use here in America and because what's out there and because it's quite expensive, I know there are a lot of clinicians who feel it still doesn't really quite meet my needs. I'm going to wait a while and see what happens. I understand that. But the point I was making for MGMA is that we really can't afford to wait too long. There is such a thing as being laggards. When it comes to IT, although America excels in diagnostics and therapeutics, in healthcare IT, we have been laggards. It is affecting our ability to compete on a global level. And I use the analogy in my old story about Cadillac's problems in the 80s with poor quality and high cost. And there are some parallels there that we in America, I think, have to be very concerned about. To my point about General Motors and American medicine more in common than you might think, there are those issues. It is getting easier to use, and I am seeing costs coming down, although probably not to the degree that most physicians would like to see. There are those that will sit on the sidelines, no doubt, but my concern is that it's pretty clear to me, based on work that I've done with the public sector and with government, that probably within 5 years, if you are not electronic, you may be able to practice medicine, but you're sure as heck not going to be able to get paid for it, and that'll be the challenge. What's really interesting to me is I hear all the time that, oh, doctors have been laggards in adopting IT in their practices because they're technophobic, and nothing is further from the truth. I mean, if you look at the history of the cell phone, doctors were using those clunky old bricks that were big and expensive and bulky long before anybody else, and they did so because it met a very specific business need. It was around their business and their patients and staying in touch. The same is true and will be true of electronic records when the doctors really begin to see the business value. I'm grateful for the stimulus. It's going to get us off the dime in this country. I don't see it so much as being a technological barrier these days. I mean, even physicians who are, let's say, in my age group, who maybe didn't grow up with technology, they're using their computer to stay in touch with family and friends and do email and monitor their stock portfolio and other things. So I think that yes, there's some cultural and behavior stuff that's going on, but I think it really, as doctors begin to understand the true business value and patient safety value, and I do know that if you go to most practices who've successfully implemented, a contemporary EMR system coupled with a practice management system, they would never go back. I mean, they'll say, yeah, it did slow us down at first. It was, it's painful. It took a while to get there. The young docs caught on faster than the older docs, but once they got there, rarely will you find a practice that says, oh yeah, I want to go back to paper. They just won't do it. Certainly the physician's role changed with the dawn of the internet. I have a saying that paternalism in healthcare died a not so quiet death with the dawn of the internet. And from my own practice experience, I certainly went through those years where patients, had information online and actually became as savvy about their disease sometimes as I was. So the role of the clinician has changed, but maybe it's a roll back to its original intent. I mean, in Latin, physician means teacher. That's what we historically have done. So there is that teaching role, that communication and collaboration role with our patients. I think the big game changer is, in fact, the communication collaboration tools that are now available. So I think that we'll no longer think of the only way we practice medicine is when we're in a clinic somewhere in an exam room with a patient. It will extend from there all the way into the home, to the office, to anywhere in the world the patient might be, with very rich communication collaboration tools at commodity prices that will allow me to move from messaging to mail to video to full-blown web conferences right into the home. And in fact, very shortly, on November 4th, Microsoft is announcing something called Kinect, which is a device that connects to your Xbox. Now, today it's all about gaming. It's a hands-free controller, basically a wireless controller that allows you to interact with your computer in new and exciting ways. But many people around the world are looking at this and thinking about the network it connects to in the home in front of the digital device connected to the internet, and realizing that this becomes a platform and a way to interact in ways that have never been possible before. So if you think about services, here's a device that basically can teach you to dance. Well, if it can teach you to dance, can it teach you to rehabilitate your leg or teach you exercises to help your back? Can it serve as a video conferencing platform to bring services into the home? These are the really exciting things I see on the horizon that, again, is about consumerization and commoditization of communication collaboration technologies. Virginia Mason is but one example that I could cite, and I hesitate to use them too frequently because I did practice there. But what I have admired about the administration at Virginia Mason is, first and foremost, they have been willing to look outside of healthcare for best practices. And I think that's so important. We can be so insular in healthcare. We only look at how we do it or how others in our industry do it. And some of the best learnings that I've observed in traveling around the world and speaking with clinicians and hospitals and practices is the aha moment that comes when they study in other industries. So it might be around looking at Ritz-Carlton for service, it might be looking at Microsoft for IT, it might be looking at FedEx for throughput and moving things through your facility. So when I look at a group like Virginia Mason, they've done this. They basically have looked at automobile manufacturing and best practices from that on how you move people and equipment through your facility and eliminate waiting, for example. They've looked at RFID tracking and how they eliminate time from the process and keep things moving along almost on assembly line fashion. They've looked at the Disney Institute and said, in Disney, at Disney World, there's the onstage experience, which is everything you see is a visitor, and then off stage there's a whole underground city where everything moves. I actually had a chance to observe that at one time. And they've actually adopted that kind of thinking in the design of their facilities, so they keep those busy hallways and the beehive area where all the processing goes on away from the patient experience, and the patients actually enter the exam room from one side, clinicians and staff from the other side, and it keeps the patient experience much more pleasant, quite frankly.
Now that you've heard what the MGMA conference attendees have to say, we want to know what you think. Click on Share Your Perspective at mdnews.com to let us know.